Hi students, this is Aisha, a third year MBBS student. Today we are going to discuss about respiratory volumes and capacities. It is the most important topic from which short MCQs will become in the NEET exam. Okay, and I know most of you will face difficulty in learning this concept. Let us discuss in detail. So we are going to discuss about lung volume and capacities. In lung volumes, there are four types of lung volumes. Those are tidal volume, inspiratory reserve volume. Reserve means additional. Okay, reserve means additional, and expiratory reserve volume and residual volume. What is meant by tidal volume? Now, during normal breathing, inspiration will occur and expiration will occur, right? What is tidal volume? During normal breathing, either inspiration or expiration, that is known as tidal volume. 500 ml of volume of air will be inspired or expired during normal breathing is known as tidal volume. Next, what is meant by inspiratory reserve volume? Inspiratory reserve means additional. Okay, now after normal breathing, see, now normal inspiration has taken place and normal expiration will be taken place, right? So after normal inspiration, this is the volume of lung, right? So after normal inspiration, additional volume of air a person can inspire after forceful inspiration. By forceful inspiration, additional volume of air a person can inspire, that is known as inspiratory reserve volume. See once again, now normal inspiration has taken place. This is the volume of lung accommodated by air. So after normal inspiration, additional volume of air a person can inspire by forceful inspiration. Okay, what is expiratory reserve volume? Expiratory means additional. See, now normal inspiration has taken place and normal expiration is taken place, that is known as tidal volume. Now after normal expiration, this is the volume of lung, right? So after normal expiration, that is tidal volume, additional volume of air which has been expired forcefully, that is known as expiratory reserve volume. Okay, so after expiratory reserve volume, see, now a person is expiring forcefully, so this expiratory reserve volume will go out of the lung, right? Some amount of air which will be remained in the lung is known as residual volume. See, if you expire forcefully with so much force, if you expire how much also, some amount of volume of air will be remained in the lung. See, how much ever expiration you do, forceful expiration, some amount of air will be remained in the lung. Okay, that is known as residual volume. If no air is present, then lung will collapse and we will die. That is why generally what always some amount of air will be present in the lung. So once again, let us recall it. What is tidal volume? During normal breathing, inspiration or expiration. Okay, inspiring 500 ml and expiring 500 ml is known as tidal volume. What is inspiratory reserve volume? See, after normal inspiration, the volume of air inspired forcefully, that is known as inspiratory reserve volume. Okay, see, now after inspiration, expiration will occur. After normal expiration, the volume of air expired forcefully is known as expiratory reserve volume. Okay, after forceful expiration, the volume of air remained in the lung is known as residual volume. Tidal volume is 500 ml Inspiratory reserve volume is 2500 to 3000 ml. Expiratory reserve volume is 1000 to 1100 ml. And residual volume is 1100 to 1200 ml. What are lung capacities? Lung capacity, first one is inspiratory capacity. Inspiratory capacity means now lung is challenging for maximum inspiration. Okay, see, now inspiration, normal inspiration has taken place and normal expiration has taken place. Now after normal expiration, this is the volume of lung, right? After that, normal inspiration and additional volume of air which is inspired forcefully, that is both together known as inspiratory capacity, which include tidal volume and inspiratory reserve volume. What is expiratory capacity? Again, lung is challenging for maximum expiration. Okay, so normal inspiration has taken place. This is the volume of lung, right? Now normal expiration will occur and additional volume of air which is expired forcefully. Okay, this is the maximum expiration, that is expiratory capacity. Okay, tidal volume plus expiratory reserve volume is known as expiratory capacity. Now, what is functional residual capacity? Functional residual capacity is this residual volume will always be present in the lung no matter what will happen. If you forcefully expire also, this amount of volume will always be present in the lung, that is 1100 to 1200 ml. Okay, so along with residual volume, expiratory reserve volume also will be present in the lung. Okay, see, until and unless you will do forceful expiration, this volume will be present in the lung. This volume of air will be present in the lung because normal breathing will be occurring. No, expiration, inspiration, expiration, inspiration, expiration. When you do forceful expiration, at that time only this expiratory reserve volume will be going out, right? So generally, functional residual capacity include residual volume and expiratory reserve volume. What is vital capacity? Vital capacity is important capacity. Now see, after forceful inspiration, the maximum volume of air expired forcefully. This is known as forcefully. This is known as vital capacity. See, after forceful inspiration, maximum volume of air which is expired forcefully. Now after maximum inspiration, this is the volume of lung, right? They are saying we have to expire the air forcefully. After maximum volume of air inspired forcefully, the maximum volume of air expired forcefully is known as vital capacity, right? So this much volume of air is present in the lung. So we have to remove inspiratory reserve volume, tidal volume and expiratory reserve volume. Then only air will be forcefully expired. No, that is what the formula include. Inspiratory reserve volume, tidal volume and expiratory reserve volume. Okay, either. Now another thing is, after forceful expiration, this is the volume of air remained in the lung, right? After forceful expiration, maximum volume of air which can be inspired, this is also known as vital capacity. Okay, see what it includes. So after forceful expiration, this is the volume of lung. They are saying maximum volume of air which can inspire forcefully. What will include? ERV will be first inspired, then tidal volume will be inspired, then forcefully inspiratory reserve volume will be inspired. So in either way, the formula is inspiratory reserve volume, tidal volume, expiratory reserve volume. What is total lung capacity? Total lung capacity is maximum volume of air a lung can accommodate after forceful inspiration. after forceful inspiration. That is residual volume, expiratory reserve volume, tidal volume and inspiratory reserve volume. I think I'm clear. Next we will go forward to this spirogram, okay, which is measured by spirometer. Okay, so in this spirogram, see this pink color line is there, no? This is normal inspiration. Normal 500 ml of volume of air is inspired, that is tidal volume, and this is 500 ml of air which is expired, tidal volume. Normal 500 ml of air inspired, tidal volume. Normal 500 ml of air expired is tidal volume. Normal 500 ml of air inspired is tidal volume. Normal 500 ml of air expired is tidal volume. See, normal 500 ml of air is expired, and here you can see this is tidal volume. Now see, after normal inspiration, see normal inspiration, that is 500 ml of air inspired during normal breathing. After inspiration, additional volume of air which is inspired forcefully, it is known as inspiratory reserve volume. See, now this inspiratory reserve volume will go out of the lung, and tidal volume through expiration will go out of the lung, and extra volume of air, additional volume of air which is expired forcefully is known as expiratory reserve volume. Okay, so tidal volume, inspiratory reserve volume and expiratory reserve volume. After forceful expiration, volume of air remained in the lung is known as residual volume. Okay, we know that functional residual capacity include residual volume and expiratory reserve volume. Right, now we will know about inspiratory capacity. What is inspiratory capacity? See, after normal expiration, tidal volume, capacity challenging the lung for maximum inspiration. So normal tidal volume inspiration, see, after normal expiration, normal tidal volume inspiration and additional volume of air which is inspired forcefully is known as inspiratory capacity. Okay, what is expiratory capacity? Maximum volume of air which can be expired by the lung, challenging the lung for expiration capacity. Right, now normal inspiration has taken place. Okay, after normal inspiration, normal volume of air, that is tidal volume, expired, and additional volume of air expired forcefully is known as expiratory reserve, is known as expiratory capacity. Normal tidal volume expiration and additional volume of air expired forcefully, expiratory reserve volume is known as expiratory capacity. Okay, what is meant by vital capacity? I told you it include inspiratory reserve volume, tidal volume and expiratory reserve volume. Total lung capacity is maximum volume of air a lung can accommodate after forceful inspiration. That includes inspiratory reserve volume and tidal volume, expiratory reserve volume and residual volume. Okay, so here we came to an end, but one thing you have to remember, spirometer measures the lung volume and capacities, right? So spirometer can't measure the residual volume. Okay, remember, it can't measure the residual volume, and in functional residual capacity, residual volume is included, right? That is why functional residual capacity also can't be measured by the spirometer, and in total lung capacity also, see, residual volume is included. That is why in total lung capacity also spirometer can't measure the total lung capacity. Total lung capacity, residual volume and functional residual capacities can't be measured by the spirometer. Okay, this is an end. Thank you. I hope I have explained clearly for you guys and this topic became easier. Thank you.